They were inseparable. And Rio was at his side that night that he died and was lying there in the morning when we came in. And he didn't want to leave Sep's side. We had to pull him away.
Each one of these people mattered. Each one is dearly missed. And each of these deaths was preventable.
Still dying, do you see us yet? Feeling forgotten while thousands died. This year alone, more than 1,000 British Columbians have died from drug overdoses. As we mark World Overdose Awareness Day, people are asking, how is this okay? And what needs to be done to save lives?
Sebastian died 4 days before we were supposed to go, so that trip never happened. So when I'm on the boat, that's my time with him.
Matthew Witt lost his son Sebastian to drug toxicity in 2015. He says that kind of loss never leaves a person.
I've been to support groups, child loss support groups. People are there, they lost their children 25, 28, 23 years ago, and they're still there every month because they need to talk about it.
While coping with his own grief, he's also fighting on the front lines of the opioid crisis as a firefighter, trying to prevent others from going through what his family has.
We're seeing 7, 8 doses of naloxone not bringing people around as, in the past 1 or 2 would do it. And that's because of the other drugs that are added to the heroin fentanyl mix.
BC is one of the epicenters of the overdose crisis. Officials announcing Tuesday that 159 British Columbians died of drug toxicity in June.
We know there are families in every part of the province who continue to feel the loss every day of someone whose life was lost tragically and far too soon as a result of the toxic drug supply.
It does not go unnoticed to all of us that this is an ongoing crisis that I have been involved in for 5-6 years now, that we were making some good progress on, but we are in a different place now.
For those who have lost loved ones in this crisis, they say they are done with words and need more action, including removing barriers to safe supply and far faster access to affordable treatment.
Let's get going and save some lives. This is ridiculous. 6 years on for me after the loss of my daughter, and the numbers are worse than ever. Come on. These are Canadians. We need to stop it.
I do believe society is changing its attitude towards mental health and addiction, and hopefully sooner rather than later we can treat it as a public health issue and not a criminal or moral issue.
In New Westminster, Ashley Burr, City News.